trying to get her to track centrally or more comfortably. Jenny McConnell has done a lot of research in the past about, you know, shifting the kneecap around and potentially gliding it medially and tilting it medially and rotating it medially and lifting it and lots of stuff. So there's heaps of different ways you can do it, and you can again do this in a rehab setting while they're doing a bit of quads rehab, hip rehab. And you can get patients to do this themselves, and they can do it at home, and they can have it on during the day, they can take it off at night, they can redo it the next day. Again, give themselves a little bit of support while they're doing their exercises. Now, certainly when Fergus and I went through uni, it was a little bit more of a case of this has to be the way it's done, and you know, but a lot more research these days is certainly around hip strength for patello femoral pain rather than specifically focus on VMO retraining. And so this is certainly one way of doing it. It's not the be all and end all that we probably thought it was years ago. So I tend to use a little bit of the under wrap just to line yourself up on the patella. So put a little line at the superior and inferior poles, make sure you're over the patella. I normally have a little bit of a feel of where that's going or where that wants to go. She feels obviously fairly tight laterally, not too bad tilting. Now she needs to be relaxed, and your clients need to be relaxed. So if she tenses her quads, I can't move her kneecap, all right? So she needs to be relaxed so we can actually have a bit of play. I tend to go from medial hamstrings to lateral hamstrings, so you've got a little bit of grab on them. Putting tape on a flat structure, you're just going to pull off. So if you use the corners of limbs, you've got something to sort of grab onto. So try and use the corner of her knees to basically grab onto the tape. So if we do it just a straightforward medial glide, literally you're there and you're just gliding medially with a little skin fold or little skin pucker on the inside of her knee. It's pretty attractive. The girls love it. So there's lots of different ways to do it. If you want to do a tilt of that patella, so if you want to sort of tilt her medially, you can start a little bit more over the patella and try and basically tip her patella medially. So you're just basically trying to dip that medial border down a bit, create a bit more of a pucker. If you wanted to rotate her patella, then you might want to, you know, angle it up a bit, and you might want to try and rotate it around. And again, there's lots of different ways to do it, but simple little ones just across, medial glide, medial tilt are generally the ones that I use. Now that might restrict a little bit of her flexion or feel like it wants to ping off as well. So I tend to, in a rehab setting, just cut a little strip of under wrap, lay that on the outside, so then it's got something to hold on to. Do you take many footy plays with this?
No, I don't, because it doesn't stay on the field.
It doesn't stay on much on the field.
And I think it's interesting, some of the taping we're doing is on for game day, and then there's these sort of plantar fascia, and this one is your rehab.
These are more rehabby ones. If they do want to play with this, that's probably going to come off, so I normally would just lightly wrap that just to stay on. You might see some of the footy boys, Greg Inglis does this a fair bit, he's got a horrible patello femoral joint. And then you just wrap that up and just lock that down for a game day situation. Again, be light across the back of the knee because it can be a bit uncomfortable.